Hi, my name is Jalin, and I will be diagnosing you today. What is the patient's name?
This is Dr. Mohammed speaking. This is your patient. You're seeing them on the screen. Her name is Habiba Mohammed.
Okay. Can you tell her it's nice to meet her?
All right. So, Jalin tana gaishe ki. She says she's also happy to see you.
So what brings her in today?
Wai mene sa kika zo asibiti me yake damun ki? All right. All right. She said she came because she's having fever, headache, and generalized body weakness.
Can she describe the fever? Is it intermittent? Is it constant? What's her temperature?
Alright, zazzabin nan ya sake dawowa ne bayan ya zo da farkon nan ko kuma tun farko dai da ya zo kawai ya tafi bai kara dawo. Alright. Um, okay, so she said this fever is intermittent fever, and here we took the temperature. It is 37.9 degrees Celsius.
Is she having headache or loss of appetite or any nausea?
Kina jin kamar bakin ki akwai ɗaci ne? Okay, amma kina jin kamar zaki yi amai? Alright, she said she's having headache and no nausea, but she's having some mild degree of loss of appetite.
Okay. And did she say, is she feeling dizziness, or you said she was feeling weak, but is she also feeling dizzy and anything like that?
Kina jin jiri ne? Okay, amma kina jin jikin ki ba ƙarfi ba? Okay. Alright, she says she doesn't have dizziness, but she has this body weakness.
What is her job? Does she work outside by any chance, or does she spend a lot of time outside?
Okay, akwai wani aikin da kike yi ne? Alright, she said she's not gainfully employed. She's a full-time housewife. She has 7 children, and she takes care of them at home.
Okay. Has she noticed any mosquito bites on her body anywhere?
Alright, sauro suna cizon ki ne ko akwai inda kika ga cizon sauro a jikin ki ko alright. Alright, she said yes, she notices some mosquito bites on some parts of her body.
Okay. So I suspect the patient has malaria, and I would like to run a rapid diagnostic kit.
Okay, that's good. Rapid diagnostic for this patient reveals 2 processes of malaria.
Okay. The 2 pluses?
Yeah, yeah, two
Okay. So
processes.
she has a mild case of malaria. And since anemia often comes with malaria, I would like to ask some questions for that.
Okay, go ahead, please.
Is she, are the palms of her hands pale or yellowish, or like her under eyes? What do they look like?
Yes, her palms were normal, and even her on the eyes, if you check the conjunctiva, it's also normal. It's pink. Yeah.
Okay, so it's sounding like she doesn't have anemia, but I would like to run a full blood count just to be sure.
All right. The full blood count revealed 13 gram per dl hemoglobin of for this patient.
Okay, so she's very healthy.
Yeah.
Well, she doesn't have
Yeah.
anemia.
Yeah.
And so it looks like her 2 pluses. It's an uncomplicated case of malaria, and it's not severe. So she would just need regular ACT combination therapy, or artemisinin based combination therapy.
Okay, that's correct. Any
Okay.
other thing you want to add?
I would like to ask about some more symptoms. So, is she feeling any abdominal pain at all, or diarrhea or anything?
No, no. Kina jin akwai ciwon ciki ne ko gudawa? No, no abdominal pain, no diarrhea.
Okay.
So,
Um, so I would just like to run a blood culture for typhoid fever just to rule that out.
all right. Yes, the blood culture for this patient revealed yield negative bacteria.
Okay, perfect. So it seems like she just has a mild case of malaria. So that would be, as I said before, the ACT therapy. And in order to prevent this in the future, she should wear long sleeves whenever she goes outside, or as much as possible, and mosquito nets when she is sleeping. Just try to do anything to avoid mosquito bites.
Oh, that's very good. You did well, Jalin. From the history, you got it correct. This patient has malaria. You did the right treatment, investigation, RDT, which shows confirms malaria tuberculosis. And you also give the correct treatment for this patient because it's uncomplicated malaria ICT combination, which is the standard treatment. That's correct. And also, you also suggested means of prevention for the future prevention, wearing of long sleeve, sleeping under mosquito-treated nets. That is very correct. You have done well, Jalin. Congratulations.
Thank you.
Yeah, you're welcome.
May you please tell the patient and thank her for being here today?
Ta ce miki wai tana godewa da amincewa da kika yi a wannan program. So she says she's also grateful and she's happy to participate, and she's also grateful for what you people have done to her.